Hi, this is the lab prep for lab number 6, intramuscular injections med administration. First off, I'd like to go over a word that you may not be that familiar with, and the word is parenteral. And it is not parental as it says on the slide. This is a word particular to medication administration, and the definition is administered or occurring elsewhere in the body other than the mouth and the alimentary canal. So therefore, it's not a medication that you can put in the mouth or per rectum or anything like that. It needs to be elsewhere in the body, which is like subcutaneous, intramuscular, intradermal, and intravenous. You will be running into the use of this word, and I just wanted to make sure that you knew what it meant and how to pronounce it. Parenteral. Blackboard Prep, the advanced skills, what we're using this time is for the injections. You can see there's 3 videos, skills that you need to watch and complete the review questions that go along with them. Also in this lab prep, we're going to be using the SMCC Nursing Simulation Lab videos and podcasts. This folder is found in the Blackboard course. On the left hand side below the item where the labs are listed, you'll see this heading. There are 4 short YouTubes that I would like you to watch, and it's positioning for where you're going to be giving injections on a person. And I thought this is something that will give you another perspective and also help you out as far as quick positioning and getting to know those areas. And of course there's a few readings on your handout. Parts of syringes and needles, and this is the first lab. I'm going to go over it in a little bit more detail. Up here we have the plunger. It's usually plastic, and it goes into a barrel. The barrel is plastic or glass, and you can see that there's an area that you measure here, and this is the stopper of the barrel. And very important as far as your measurements are concerned. We'll talk about those in a minute. There's a tip, and the needle is separate. You have a hub here, a shaft, and a bevel. This is the sterile area that needs to be kept sterile, and there may be a gauge number on that. We'll talk about that in a second. Standard size syringes, there's 1 mil syringes. You don't see used too often for IM injections, but there's 3 mils, 5 mils, and this is here for show purposes only. You would never use a 10 mil syringe for an IM injection. It just doesn't happen. Plus, you would never give that amount of fluid. The one you'll see most often is a 2 to a 3 mil syringe, and you can see where the increments are on here. Very important that you know and understand these increments, because you'll be using those when you drop meds. And you can see the difference here: 1 mil, 2 mil, and you can see if I wanted to do something with much more tightly controlled, I would be using a 3 mil syringe here, and you can see those increments in 0.5. The difference between luer lock and slip lock: the syringe that I showed you initially had a slip lock. The needle actually stays on there with pressure. Luer lock is much more secure, and you can actually screw these on. You can use each, and I have used both in my career. You're probably going to see more luer locks. As far as the injections are concerned, usually you're going to give it at a 90-degree angle straight in, because you need to get it into the muscle and get it by the subcutaneous tissue. This can be a challenge in some patients. If so, you have to always make sure you pull the skin taut prior to injection. You literally try to flatten out that subcutaneous tissue. You aspirate, in other words, pull the plunger back to make sure that you're not in a vessel. And then in the only time that you wouldn't aspirate is if you're giving like a deltoid injection, which would probably most likely be a vaccination or flu shot. The other time you would not aspirate is the anterior lateral thigh for infants, and this is been determined due to the research that they have and the lack of large vessels in those areas. The 3 areas that are most common to give injections: deltoid, vastus lateralis, and ventral gluteal. You'll be becoming quite intimate with these and quite familiar. They do have different ramifications of giving injections, and that is here in this slide. You can review at your leisure. The gauges of needles, and if you take a look here, you can see that certainly the bevels are different sizes. The shafts are long in some, shorter in others, and then the color of the actual hub. The color indicates the gauge, and the color depends on the company, so I can't really say like a turquoise is a 21. I can't say that for sure. So you really need to know what your facility uses and get comfortable with that. One thing I can tell you, the smaller the number, such as 14, 16, 18 gauge, those are the larger bevels. So the lower the number, the larger the bevel. The higher the number, say 30, 25, that sort of thing, 26, the smaller the bevel. So if you had a choice yourself and which type injection you'd like to have, I'm sure you would go for the higher gauge. But it makes a difference. You're going to use the longer needle for an IM. You can use a shorter needle for sub-Q. So again, introducing you to the concepts of choosing needles. Preventing needle sticks is of all importance. You can see two types of devices where you're going to actually dispose of the syringes. The one on the right you drop in and you can see that it's probably pretty full, and that one needs to be covered and put and discarded of because it's getting pretty full. The one on the left, the tan one, is a great one because it's on the wall. You can see when it's getting full, and you literally place your syringe in a horizontal method, and it pops in when you move it. It's a very safe place to put needles and prevent from needle sticks. There is a one-handed scoop method. We don't use it too often, but if you do need to recap a needle, usually it's a sterile needle after you've drawn up some medication. You must do it one-handed, and this is one way we will practice in the lab. If you get a needle stick, you absolutely need to report it, make an incident report, but the very first thing you need to do is wash the area with soap and water vigorously, report the incident, and you may even have to have medical treatment. Blood usually has to be drawn from the person, possibly from you and from the person that the blood that you were contaminated with. This orange device here over on the right is another device where you can actually put the cap of a syringe needle and you can recap it that way. It's a very safe way to do it. You can also use a good old-fashioned med cup. Put a cap in there and recap that way. So be very careful when it comes to needle sticks. Of the injection sites, the two sites that I wanted to show you is the ventral gluteal site and the vastus lateralis. This ventral gluteal schematic is a great schematic because it literally shows you where your hand needs to go in order to find the location of where you're going to be giving your injection. I like the fact because the fingers here make a V, and your injection site is right here in the middle. The palm is over the greater trochanter, so you can see the thumb goes towards the center of the patient. On the right-hand side, the vastus lateralis, you'll need to know your locations, greater trochanter and the lateral femoral condyle. If you can identify these two areas, then you know that the middle third is where you're going to be giving an injection, and that's a nice deep muscle for IM injections. You'll see we'll be using ampules, vials, pre-filled ampules in the lab, and you'll learn how to use those and draw medications safely up out of those. When it comes to the lab itself, we'll be drawing up, but we'll also be demonstrating the IM procedure. We'll be using oranges, and we also be using other devices that you can inject into. We will also be using the MAR, and we'll use that to draw up different dosages of medications, and you'll also be charting on it. So that ends the prep for lab number 6. If you have any questions, by all means email me or bring them to the lab. Thank you very much.